Test 1, 2, 3. Eric, y'all good?
Yes.
I'll take that as a yes. Welcome to the Joint Finance Planning Committee meeting this morning. It's 10 a.m. on Thursday, February 22nd. I'm informed of no citizens wishing to address the board, so we will move to our approval of our minutes from our November 16th, 2023 meeting. Entertain a motion. Motion from Ralph. Second. Yes, sir. Dr. Davis. I'll get all this right, Dr. Davis, eventually.
Thank you.
Perfect. That's what I answered to. All right. Any question or discussion? All in favor say aye. All opposed, same sign. That motion carries. The minutes are approved, and we will then, Jill, ask you to come and give us an update on the master facility plan construction project. Good morning. There's one meeting ahead.
Yep. We're going to fast forward.
Probably nobody would object to moving the agenda that quickly along.
Right?
I should say while we're waiting, Zim, welcome to the Finance Committee. Happy to have you in our midst and look forward to your contributions. I'm ready if you are.
Oh, I can get started. Y'all have copies of it in front of you.
All right.
Alrighty. So Medical Home Southwest, we'll start with that dashboard placemat. As presented last month, a reminder that due to permitting delays, the opening date is 4. We're starting brick and stone install as well as completing the exterior framing this month. So we're quickly closing in on this building. You are seeing a continued increase in the spend with the cash flow, and we'll continue to see that increase as we're closing in. As with all projects, including this one, we're working alongside Broadus and our consultants as we look for continued savings opportunities for all of our projects. We know there has been escalations, obviously, in the global economy as well as supply and construction cost. In Texas, and really specifically DFW has seen unprecedented construction projects. And so we're going to continually work internally to refine our models, and we'll be bringing that forward initially in our next master facility planning bond steering committee that will be kicking off in March.
Okay. Very good. Any questions for Jill? Okay. Thank you, ma'am.
You want me to go on?
You go through each one?
Is that all right?
That's fine. You
Okay.
bet.
Psych Emergency Center, the foundation and pier drilling is complete. The connector steel will be done this month connecting to TSP. So we'll begin to see that we're coming out of the ground with one of the 5 concrete slabs poured this week, and we'll see some steel actually erecting over the next month. And again, we're starting to see some increases, very slight though, in our spend. Temporary parking. So this is likely the most challenging part of all the projects because it affects all of our staff, and, really want to thank them because this is the part that, they are, tolerating our inconveniences with our parking on the main campus. We are completing some of our temporary lots, and we'll be timing those opening of those lots. They may be completed, but we're going to time the opening with the moves of the JPOC capture parking lot in the future. So,
Jill, you said you think you can bring us kind of a true up on all the projects at the next meeting. Is that fair?
Yeah, we're going to work through the bond steering committee, and then Cummings is finalizing some of their reports as well as PwC with their modeling. And so, yes, we are working towards that.
Okay.
Yep.
Perfect. Thank you.
And I'll also just mention, we talk about these 3 projects, but all the projects are in some sort of process. We may not have kicked, open ground and started construction on all the projects, but we are meeting on the medical outpatient building. We're meeting on the tower that's kicked off, starting those design conversations, as well as the North Pavilion expansion, central utility plant, and all the projects are in some sort of motion.
Okay. Fantastic. Any questions for Jill? Medical facility plan. All righty, fantastic. Thank you, ma'am. We appreciate it.
I thought you had.
No, go ahead. Yeah.
I'm going to ask the same question I asked before. You show your projected cubic line and your actual cubic line, and they're not anywhere near together. And yet I've been told over and over again we're on schedule. So I hope when you come back, you'll have a more fluid and actual situation of where we really are.
Yeah, you can see as we get, it seems like the spend gets closer, you're getting closer to towards the end of those. If you look at Medical Home Southwest, for example, it's a little bit slow. Your question is always great. But you can start to see that we're starting to really start to spend as we get the structure up and get inside.
It's what we've been told in the past versus what the charts say. That's what I have a problem with.
We've kind of tasked Price Waterhouse with that sort of true up, and Jill's made some observations about that process and about those charts that I think will make this a little simpler.
Yeah, I just want to see the fidelity of the thing. Thank you.
Yep, thank you.
All righty, Rory, we have the CFO update and consideration approval of the unaudited financial report for 2024. Good morning.
Good morning. We'll take care of a couple of housekeeping items before we get into the financial report. The bond ratings for our 4 major rating agencies, 3 of those have been completed. We are waiting on Moody's to give us a report. Probably will come in about 30 minutes. So we'll have, there have been no negative outlooks for us, so they've been positive. We don't expect anything different from Moody's, but we'll keep you updated on that. There's also a quarterly investment report that's out on the portal from Hilltop. Just want to remind you that you can view that in the portal.
So you contemplate all those ratings staying the same at this point?
I do. I think they're pretty solid. It would be a surprise at this point if it changed. So.
That's great news, considering the amount of money that we've netted.
The magazine.
Yeah.
Sees us in good
In fact,
financial.
that didn't get mentioned. Karen, would you, mention that? I'm not sure everybody knows about this, but the shout
I'll
out that we
let
got.
Rory, Rory, you want to mention what came out in Becker's?
The Becker's article last month.
They picked up one of the rating agencies and reported on it, and it was an article regarding 10 top hospitals with strong financials and strong bond ratings, and we were in that article.
Yeah.
We were somewhere down the list, like 5 or 6, I think.
But the only public hospital.
The only public.
That's correct.
That's impressive. That
Yes.
really is. Congratulations.
Need to be in 5 or 6 is still excellent.
You're not kidding. Absolutely is. All righty.
All right, so we're roughly, not roughly, we're a third of the way through the year. It's crazy how this year is progressing as quickly as it is. In short, for January, we had strong admissions. We also had strong ED visits as well as urgent care visits. You can see the percentages there, 2%, 14%, 7% respectively in those categories. I will speak to one government settlement a little bit later that we had this month, talk about that. There's been continued expense, I wouldn't call it control, but I would just call it a little bit of lag in certain expense categories. And so we'll talk a little bit about expenses, and then just overall a positive operating margin as well as net income. So let's take a look at the stats. I did mention admissions, and then length of stay continues to be below budget. So a lot of effort working with throughput and just generally pushing patients through the system. Positive indicators there. I did mention ER and urgent care. You can see those. The clinic areas, we do have a very aggressive budget in primary care. We are looking at all of the ways that we can exceed or meet that budget, but we did set a very high target. Specialty clinic, of course, is about 10%. Care visits are above about 10%. I've been talking a little bit about surgeries over the last couple of months, just looking at the trend. I'm very close to having something to bring back to you regarding surgeries. I think we've got some strong information that will tell us what's going on there, but I want to do a little bit more validation before I bring that back to you, probably at February's report out. Behavioral health, we've talked about quite a bit, and the PEC in particular. One of the things that I was able to do this month is take a diagnosis list of patients. And so what I did was put the diagnosis down the left-hand side of the page, and then I put PEC and then clinic side by side. And what we are seeing is a shift in depression from the PEC to the clinics. And that's a major organizational goal that we have this year, is to create a remission of depression in the patient. So you can literally see the shift from the PEC into the clinics. And we've spoken about it anecdotally, but I actually wanted some data to back that up. So I did go pull that data. So definitely feel like that is what's happening with the PEC.
So we think you've got a legitimate statistical correlation now that we've actually been able to move the dial on the number of depression patients that have been reporting PEC that are now being treated through the clinic.
Yes, I pulled a diagnosis specific that tells me why were they here, either place, and you're seeing this rise in the clinics for depression treatment and a fall in the PEC.
Wow.
Just to remind the board, that metric, what we did was to now spread out across the organization that screening for depression. So everywhere that patient enters, the system will get screened and have some action taken depending on where that score is. So just by doing that, it allows for earlier intervention, and what we think is that's leading to a lower number that are showing up in the PEC in crisis.
That's great. Rory, would you maybe at next meeting be able to share that report?
Absolutely. Yeah, it's very granular, so I'll have to summarize it a little bit for you. But
Well, to be able to just illustrate the fact that we've done something that because of a policy decision made here, we're moving the dial. And we're improving patient care, we're reducing cost, and ultimately, hopefully, reducing the demand on PEC. So those are all huge variables for us.
yeah, and if you look at the delta between the two, it's not between -8 and 5. It's not a huge number, but you definitely see the diagnosis for, say, major depression. You see a lower number in the PEC and a higher number in the clinics.
That's great.
So
That's great. Congratulations. Let me get Zelia in here. Tell us.
last line, provider volumes. I'm sorry.
I was just saying thank you, Zelia.
Yeah, right back there.
Being really quiet in the
I would like to
back.
say it's a team effort with everybody here, but especially community health.
That's great.
It's a great partnership with them.
Congratulations. Thank you, guys. All righty, Rory.
All right, provider volumes is the last line there. I've never really spoken about this one. It's kind of an interesting statistic that we look at. It's really, if you travel in the physician world, there's something called a relative value unit, and that is typically how we measure activity. And also, there's some drivers and compensation related to RVUs. So you see we're about 20,000 RVUs above our target or our budget for January. So a lot of activity going on in that. So we won't speak about year-to-date a whole lot. What I would say is everything correlates from the monthly to the year-to-date, with one exception. Outpatient surgeries in January were up. We are down about 1% year-to-date, but everything else it correlates very closely for the year-to-date trend and the monthly for January. We'll hit a couple of graphs here. As I mentioned, admissions are trending very close to budget, but slightly over in January. Had a very odd case mix month where it was 1.73 and the budget was 1.73. I've never seen that happen before. So that was interesting. Interesting for nerds like me. So, and length of stay I mentioned. So very much below the red line budget there year to date. Talk a little bit about outpatient. We are seeing, again, higher ED visits, higher urgent care visits, and then I spoke to the primary care visits in both specialty clinics. So I am really thinking about how we kind of consolidate some of the graphs in the future, because we talk about them on the line item page, and then we come back to them in the graphs. So I think I'll probably have some different looks for this data going forward. It's kind of repetitive, and I hate to do that to you guys.
Thank you.
This is what I mentioned on surgeries. It really is in general surgery. As you can see, the biggest decrease from inpatient and outpatient. And again, I'm at the finish line on putting the pieces of the puzzle to that one together, and I'll bring that information back to you. We covered behavioral health really, really well. Any questions on any of these statistics that kind of jump out at you? Clicker is not acting right today, so. Okay, we'll head into the financial metrics. Payer mix is very much stable over the prior periods. You really are seeing that commercial increase in marketplace patients, as well as some decline in our connections percentage of payer mix, as well as self-pay is up slightly. I'm not looking at my graph, but I'm thinking I've got those correct. But it's really a shift out of Medicaid into that commercial marketplace category, and you'll see the green bars substantially lower than where we budgeted, as well as the prior year. Nothing really, I don't think there's anything alarming there. I think the one thing would be the self-pay, as it kind of really jumped in the month of January. There were a lot of things going on in January. Weather was one of the bigger things that happened. So we're just going to continue to watch that self-pay payer mix and see how that trends. One note on the cash collections, we do see a little bit of a dip below the actual budget, the red dot. We had a very high net revenue month in January, and so it's a timing difference. We will see that cash come in. It takes about 45 to 60 days to really collect everything that we should. And on average, so we see a high net revenue month in the month of January, and it looks like we didn't collect what we should, but it's really just kind of a timing difference. And then I mentioned last month, I believe, that the connections enrollment automation, we are doing some things to re-enroll patients on a month-to-month basis. So we've started to see a little creep there gradually, and you'll see that for quite a while until that levels off. Okay, so we'll get into the heart of the matter here on the income statement. As I mentioned, net revenues, we are over budget, $10 million in net patient revenue. That is largely just payer mix favorability, as well as volume. So our volumes, especially in the outpatient revenue, were very high. I did mention supplemental funding, government settlement earlier. We have been seeing about a $2 million variance negative in supplemental funding for the first few months because we were catching up for the DISH $8 billion cuts that we reviewed in the last meeting. We had an actual increase in our HARP payments that offset that decrease this month. So we received more money and will receive more HARP money for the year than we expected.
That's not an actual DISH cut yet, though, right? That's an accrued DISH cut, right?
That's correct. Yeah. We are still watching that one travel through legislation, but we are planning for the DISH cut. So the other operating revenue category, I mentioned the government settlement. We did finally receive our 340B payment. If you look at what happened with 340B, CMS made a cut back in 2018, and that was challenged through the court system, and CMS was ordered to pay that back. So we're getting higher drug payments in a lump sum that was a previous year cut. The irony of it all is they're actually going to take all that back over a 15-year period. They're going to, so it kind of washes out over a 15-year period, but we did receive that $4.3 million in January. That's really the top side. So really of the Of the 14, about 4 of that, again, I mentioned is the 340B, and then another 2 would have been the HARP increase. So 6 of the 14 is really in non-patient related activity. Salaries are still trending below budget on the expense section there, primarily due to timing of market increases. We are very close to wrapping that up for the month of February, and then through April, we'll be kind of tying that up for our market adjustments for employees. You do see contract labor is lower. We do have a higher FTE count, though, as a result of lower vacancy. So,
This one's based on anniversary date, or is that just fiscal year?
it's a fiscal year adjustment, but it has nothing to do with the employee's anniversary. It's a study-based approach that we take to see if we're paying fairly in the market.
Okay.
So we study 3 different external sources, and then we come up with a kind of a delta of where we think we should be in relation to the market, and then we adjust. We have historically been somewhat a little behind, so we're trying to do a better job in keeping up with that so that we don't have these larger increases year over year.
But we budgeted in a manner to contemplate what we consider to be the highest exposure, right?
We did, and we are currently trending below what we budgeted as an impact, so.
Great.
Yeah, good question. Purchase services, we'll get down into the third section there. Really, I talked about the expense and the initiatives that are kind of just now ramping up. We've got several things, and of course, IT that relate to purchase services. We are starting to see those expenses ramp up. We have seen a little bit lower outside medical services for the year, lower, really tremendous control of length of stay in behavioral has allowed us to keep more of those patients here and not use so much outside help on those behavioral admissions. And then we did have a really nice January pickup with housekeeping. Joy and her team actually went through a contract review, and they had some labor reconciliation for the housekeeping contract, as well as just looking at key performance indicators that were not triggered. And so there was a rebate. So that's a really good piece of work there. And one of the things we commend Joy, I think.
Nice job, Joy. Thank you. That's awesome.
So all in all, operating income for the month was, I skipped supplies. I was just going to mention supplies as just mostly drug costs, specialty, retail, and that volume piece was higher. So operating income overall, 20.9 million favorable, and then net income, 29.3 million. So just a reminder, 6 million of that was in that non-patient activity, and you have a lot of expenses that have not moved in yet. So.
I just want to, I love this page. When I read it, when I was getting ready for this meeting, I wanted to call Dorothy and we just high-five each other over the phone. This is great, and it reflects great work. I mean, we're under on expenses. We made $29.3 million last month. I mean, this is just phenomenal. So thank you to everybody for this.
Good job.
Thank you. A couple of comments, really, on the balance sheet. It looks very similar to prior months. I would note that the days cash on hand operating went to 224. The future fund is still at 192, so we are at 416. So that is creeping up due to the timing of the ad valorem payments that start to arrive in January. So that we'll reach our peak there in around March, April, and then we'll start to see that operating cash start to fall back.
Hey, Roy, on your bond rating calls, did the raters ask you whether or not we intend to stay on schedule in terms of issuing additional debt?
Yes.
They did, and we did tell them, 27, we're still planning that second issue.
Okay.
Yeah.
So with that disclosure, there still wasn't a reduction in rating. So that's a pretty good indicator of a lot of confidence in JPS's finances, willing to, continue on through the bond project.
Yeah, they asked good questions, but they're dealing with a 5-year projection, really, and over that 5-year projection, there's still a lot of stability within JPS, and so that's really what they look at, and they go over things pretty thoroughly from cash flow, future cash flows, and our ability to meet those obligations.
Good.
So.
That's great. Good news.
All right, that concludes my report, unless there's anything else I can
Questions
answer.
for Rory?
I would just make a...
Being used for relative value, RVU. Does that number pass on to a claim so that they can use that for strategic, to work on compensation, all that stuff, to understand the economy of scale because the volume driven?
Yeah, actually, a claim is the main driver of the data in the RVUs. So we're actually pulling that number from them over to our report. A lot of times when you look at just volume, it doesn't capture everything that is being done in the clinics with the physicians and the APPs. So we want to kind of look at that provider volume number, but they're actually the ones generating the RVU. And it actually does translate into compensation for, I would say, the majority of the physicians, not all, but the majority.
Because I was wondering around the work RVU and then the expense and the malpractice, right? And then when they drive certain volume, they create more risk and the malpractice will go up or down and all that stuff. So just understanding what are we dealing with from a strategic standpoint?
Yeah, when you speak to the RVUs, there is that malpractice component. I will come back to you and try to maybe go offline and look at that malpractice component and how it. I think what you're asking is how does that correlate to compensation versus risk?
As we plan, we know where's the economy of scale, how much volume we need, how many patients, and then when we recruit type thing. We can take it offline.
Yeah.
I just want to make sure that we.
That'd be good.
All right, any other questions for Rory? If not, Rory, you're still up on our first
Okay.
approval of group specialist physician fee for service. Oh, I'm sorry. I'm moving us forward here because Zim's got to leave and I don't want him to miss a thing.
We need to make a motion to approve the
All right, we need to get a
unaudited
motion for the
financials.
financial reports. Motion from Zim, second from Dr. Casey. Any question or discussion? All in favor, say aye.
Aye.
All opposed, same sign. That motion carries. Thank you, sir.
All right, so item B is a contract, moving along into the contract section with WellMed. So WellMed patients were being seen and paid through a contract with United Healthcare. They are, WellMed is owned by United Healthcare, and in this contract, we are simply moving the paper or the contract under WellMed. There's no expense increase. There's no revenue increase. It's just simply contracting with WellMed instead of United Healthcare. I may have mentioned before, but WellMed started out as a primary care network, and they kind of borrowed the specialty network from United Healthcare, and this is their own network now. So I'd request the approval on that.
Move
Need a motion? Motion from DT?
Yes.
Second from Ralph. Any question or discussion? All in favor, say aye.
Aye.
All opposed, same sign. The motion carries. Thank you, sir.
Okay, item C is an agreement with a master services agreement between Mainsail and doing business as Asperion. So what this is an agreement to increase collections. These are difficult accounts receivable cases. So we have certain accounts that we reach barriers on, and we need a little bit higher level of expertise, and this company will provide that. For every dollar spent, we expect to collect 5, so it's a 5-to-1 ratio. JPS does not pay until we are paid. And then we did do a pilot about a year ago. We did a pilot of 5 different accounts receivable patients in the AR, and we collected about $50,000 per account. So those are anything from insurance company barriers to difficulty finding patients, and just it's a wide spectrum. Any questions, and would request approval on that?
Performance-based contract.
Performance.
We don't pay unless they produce, so. any
Yeah, that was my
questions?
only question. It's for every $1 or for every 5, we give them 1, but it has to be collected.
That's correct.
Great. Yep. That's great.
Any other questions? If not, we need a motion. Motion from Ralph. Second from Zim. Any question or discussion? All in favor say aye. Aye. All opposed, same sign. That motion carries. Thank you, sir.
Abstain.
That reflect DT abstaining. Lonnie, thank you. All right, item D.
Okay, item D is not only a contract, but a sole source exemption request. BioSense Webster provides supplies for electrophysiology studies. Not to get too medical, because that's out of my lane, but electrophysiology would be, signals that produce the rhythm of the heartbeat. So that's why we need it, because we're doing testing on patients, and we are using BioSense equipment, and the supplies are not available through any third-party distributor. So you will note in the packet there's a letter from both JPS and BioSense indicating that they do not distribute through anyone else.
So this motion needs to include a sole source exemption component to it. Need a motion?
So move.
Motion from DT, second from Dr. Casey. Any question or discussion? All in favor say aye. Aye. All opposed, same sign. The motion carries. Thank you, sir. That takes us to item E.
Okay, item E, MedStar. We are seeking an exemption from competitive solicitation on this one as well. And it's simply because there's no other practical provider of services in the area for 911 emergency transports as well as non-emergency transports. The sole source letter is also provided in the packet. This is for inmate transportation to JPS, loaded miles one way from the Tarrant County Jail. We expect to spend about $483,000, and we are going to absorb this into the operating budget. It was not budgeted in '24. These services were not previously billed to us by MedStar. These have never been billed in the past.
Where were they billed?
Who did they bill?
Yeah.
My understanding is no one.
Need a business model like that. That's a great game.
Why does the county not pay for this?
I'll let you.
We are responsible for the jail care. So if our physicians now deem that that patient needs a transport to a higher level of care, it is now our responsibility to ensure that patient is moved to JPS.
Well, my other question, and I know we've talked about this some, I mean, what's our plan, and this isn't really on the item, but what's our plan to, like, you know, if Dorothy goes to jail, Dorothy has insurance, I think. Do we try to recover that at all, even for these rides, even for the care that we provide here?
So I'll let Daphne speak to that. County hospitals have looked at that. It's a little bit more complicated than just gathering that insurance. I'm not even sure whether we're.
Yeah, it really becomes more of a practical issue of having the information to bill. But to your point, it is something that we've talked about. Like if we're able to capture it, we would be able to bill those patients, to your point.
Does that go to subrogation from one of the vendor that we have?
I don't know about subrogation necessarily, but most of these patients, you were supposed to notify Medicare. The jail is supposed to notify anybody that say has Medicare or Medicaid if they're there 60 days, and then they actually lose that coverage. And then, of course, if they're dismissed from the jail, they can re-enable that coverage. But like Daphne said, it's the availability of the information and being able to know. We have built some insurances in the last few months and have some, it's typically low recovery. It's not, there's no way we're going to collect above 50%.
Yeah, I mean, it's just a tough spot for us to be in because here's a new $482,000 charge that we're having to absorb that we've never done before. And it's, I understand the scenario and it's hard to really point a finger, but, if we can even recover a tenth of that.
Right.
That's great. I understand the difficulty.
And this go in our cost report?
Let me think through that. Good question. Cost report. I got to get back to you on that. I don't know if it would flow through.
I think it does.
It might be.
Yeah,
It might.
it does.
Yeah, we actually have been through this discussion many times over the years about what JPS's capacity is to go recover, ambulance billings or many other categories for that matter. I just didn't know that we had never been billed for this. That's fascinating.
Well, once upon a time, JPS paid dollars to the ambulance service. When I was here, that was one of the contracts that I had to manage. We paid dollars to them for services.
I just like forget to bill. It's weird.
Can we forget to pay?
We have been billed for what I call outbound transports. MedStar will transport a patient to a unit or to home. We've been billed for that, but for jail patients, we went back through 2 years of history of claims, and there were no billings. So,
well, I guess we enjoyed it while it lasted, didn't we? All right. Any other questions for Rory on this transportation agreement?
Okay.
No, we need a motion.
Move approval.
Move from Zim. Second from Dr. Davis. Any question or discussion? All in favor say aye. All opposed, same sign. That motion carries.
thank you, guys.
Thank you, Rory. That brings us to Jill on our, am I right, on the item F, pricing and consignment agreement with Artivion.
Yes, I'm requesting your approval for a pricing agreement with Artivion and JPS. This is for a contract that provides heart valves and vascular implants for our patient. It was awarded through a part of an RFP. Total 5-year contract is a cost of a little bit over $544,000.
Just to be clear, that motion you just made included the sole source exemption, correct? So we covered that.
Yeah.
Okay. Sorry about that. Dorothy was giving me the stink eye over there. I could feel it. All right, Jill, sorry. Go ahead. Any questions for Jill on this contract? All right, we need a motion then. So moved. We have a motion from Dr. Casey.
Second.
Second from Tim. Any question or discussion? All in favor say aye. All opposed, same sign. That motion carries. Thank you, Jill. And now we are at the design build agreement with Beck Proterra on joint venture for the parking garage.
Yep, I'm requesting your approval for the final guaranteed maximum price for the design build amendment for the new parking garage. This will increase the existing $38 million released by the first 2 work packages by a little over $45.3 million. To the final construction amount of just over $83.6 million, which is within the budget of the program.
So this one hasn't seen enough escalation that it went over the budget for the project?
Not yet.
Okay.
Not that we're aware of.
Okay. Any questions for Jill? Otherwise, we need to go get a parking garage built. Emotion.
I'm surprised, though, that it does not meet the required 25%, because I know the contractors there. So I'm surprised that it says that.
So the precast structure does not get accounted for in all of this. It does not meet those requirements at all. Beck Proterra did get extra credit for the outreach that they did as part of this, but I think the final, the final percentage will be around 11 or 12%.
Okay.
Does this one have to go with the county?
It did.
Yes.
It does?
Yes.
Okay.
Or no, it did already.
It already
Oh, it did.
Yeah,
So
they
they're
got
good.
selected
All right.
already. Yeah.
Perfect. Okay. So we need a motion to approve then.
Move approval.
Motion from Ralph. Second from Zim. Any question or discussion? All in favor say aye. Aye. All opposed, same sign. The motion carries. go forward with parking garage. Item H, construction agreement for MRI Room 1.
All right, good morning.
Congratulations. Thank you for your work.
Thank you.
Good report.
I have to say, Helen Pena, she helps with all of our contracts, and monitoring contracts is part of what we're supposed to do for those KPIs, and she's done an excellent job. So if she's watching Finance Committee, not that many people do, but I appreciate her hard work.
Watching Finance Committee, you probably have another discussion.
Yes.
Yeah,
Well,
that will
and,
be.
and for Helen's work of that amount, that was $700,000. And I can tell you that HHS is a good partner, but definitely making sure that we are achieving our goals and getting what we deserve
Yeah.
back is important. So.
Fantastic.
Anyways, thank you. Yeah, so back to this agreement that you have in front of you. This is I'm asking your approval for the construction agreement between Hutchinson Construction and the district. This carries a cost of $2.7 million, which is approved in our capital budget. This is the construction that is required. We have an MRI that had to be decommissioned, and so this is the construction that would support us replacing that MRI so that we can get back into services. And so this was awarded through RFP and definitely very necessary. So.
This meets our 25% MWBE requirement
Yes.
as well. So we need a motion?
A question.
Yes, sir.
How many people responded? How many people do we have bid? Anything like that?
So for this one, actually, this was a sole bid. And Hutchinson is a Tarrant County, I think they're based out of Arlington. We've done business with them before. And so our team that went through that with facilities felt very confident with their response.
I mean, do we have any concern that we only received one bid on this?
I think back to kind of what Jill was mentioning about the demand of construction services within DFW, I think that we have seen maybe some less response. Hutchinson, in this case, specifically for us, we've done business with them before, so our team felt confident in their skills and services. But certainly in any RFP, we always like to have multiple respondents.
So this is not a sole source provider, it just happens to be the only bidder.
Only bidder.
We don't have them in the motion. Right,
Seeing
Yeah.
more and more of this just because it's so busy in the DFW area.
yeah. Okay, any other questions? If not, we need a motion.
Before I motion, it's comical that we're decommissioning something, so then we're going to commission. I'm thinking about the military. You lost your stripes, now you're going to get some new
Same
stripes.
thing.
Probably not that different, probably been worn out for a while and.
You know, that symphony, the Symphony One has served us well many, many years, so it was time. So yes, it was decommissioned, so we'll
Move
commission
approval.
something new.
All right, motion from Ralph, second from Dr. Casey. Any question or discussion? All in favor, say aye. All opposed, same sign. That motion carries. Thank you, Joy. And now we
Right.
are on the equipment rental and shared imaging.
And these two, it's nice for these to go together because what this is, I'm asking for approval is a rental agreement between Shared Imaging and the district. It carries a cost of $1.4 million annually, which you can see is really going to be in our budget for 2025. This allows us to begin the process so that we can bring a 1.5 Tesla, 3 Tesla modular mobile MRI that we would have mobile for us because, one, it's going to help us with capacity for MRI, but as we plan for our master plan for other MRIs that we would replace. As we build, we need this. And so Shared Imaging is on our GPO, our pricing with Vizient contract. And so they will begin to work with the architecture and all of the team for design to begin to bring this on site.
Joy, do we, are we, I'm sure we are, but to the extent that we are building new buildings and facilities, and in some cases, those buildings could be built before the life end of these capital assets, is there provision made or consideration given to how these get transferred into new buildings?
So these are actually leased. So these are rentals, so they will not go into our new space. But certainly for like the MRI one that I was talking about, that is able to be picked up and to be moved.
Good.
And so that is this. This is going to help us staging when you think about the phasing of what we have to take down and bring up and continue services.
Okay.
So, yeah.
Is this in addition to the vendors we're using right now
Midtown?
Midtown.
Yes, so that will help us. So right now, as MRI went down, we've partnered with Midtown Imaging to send patients to them for MRI outpatient services because we're running our existing MRIs 24/7. We're booking those. We will bring that back in-house as we have these mobile and modular options on site. Unfortunately, it takes 12 to 18 months to get these up, even when you say we're ready to go.
So we'll maintain Midtown.
In between,
interim.
yes. A lot of,
So MRIs 24/7, not just emergency, but they're scheduling MRIs 24/7.
we are running
it's
them around the
nonstop.
clock.
So you'll wake up a patient up at 2 a.m.
Yes.
Time for your
Inpa-
MRI.
We bring them down inpatient.
We do.
Stand in line to get there.
Get in line to get the MRI.
That's right, we do.
Yeah, just pull it in there. Put him in line. All right.
Lean into it.
Any questions for Joy on this imaging agreement?
It's for 48 months, yes, sir.
Any other questions? Okay, we need a motion. Motion from Dr. Casey.
Second.
Second from Dr. Davis. Any question or discussion? All in favor say aye. All opposed, same sign. That motion carries. Thank you very much, Joy. And so now we are at Master Services Agreement with Relief Care. Did I pronounce that right? Late Care?
Oh, I think we're, let's see, maybe I'm out of.
Oh, I'm sorry, I skipped Siemens.
Okay.
Pardon me.
This is another one. Yes.
Item J.
Item J, yes. So I'm asking for your approval for this master equipment and products agreement between Siemens Healthcare Diagnostics and the district. This carries a cost of $293,000 annually, which is included in our FY24 operational budget. I can tell you, I know here it says over a 10-year contract term, and we had conversation about this because I was prepared for this conversation. This is basically Siemens. They are going to provide us these analyzers, chemistry analyzers, and will allow us in the supplemental term to replace those. And so when we looked at the total cost of these analyzers, it came out to over $3 million if we were going to do a direct purchase of this. So this gives us the latest analyzers as well as the equipment and supplies that we will say we have a minimum guarantee requirement of purchase that we have to do. But it'll allow us to have all of those analyzers without that $3 million expense and allow us, when we move into the new towers, for us to have a brand new machine as we go in there.
So what's the purpose of the 10 years then? What does the 10 years stipulate?
So essentially that we are guaranteeing that lease term of those analyzers, that we are committed, and then we
Okay.
are committing
So
to.
10 years, they're going to be replacing them as needed?
Yes,
Within that
we
term.
will get a
Okay.
full replacement of that. And so we went back and looked at that buy versus lease, and certainly I knew I did not want to come forward with a 10-year contract term to this board, but I will tell you Siemens gave on some other negotiations around caps for increases on the products, as well as waiving some of that insurance requirements. So our team, Daphne's legal team, they pushed very hard, and I can tell you if Dr. Miles was here, this is the state-of-the-art equipment that we need, and that will definitely help us from an efficiency, throughput, quality, and safety for our patients.
And prepare us for the future.
So this includes any escalation? This 2.9 million is
That's the estimate.
great. Any other questions for Joy? If not, we need a motion.
So moved.
Motion from Ralph. I didn't hear the second. I'm sorry. Tim, thank you. Any question or discussion? All in favor, say aye. Aye. All opposed, same sign. That motion carries. Now we are at Relate Care. Item K.
Thank you. Yes. So I'm asking for your approval for the master service agreement between Relay Care and the district. This carries a cost of $234,000 annually, which is approved in our operational budget. What this does is it provides after-hours, weekend, and holiday coverage for our nurse triage. We provide 24/7 nurse triage coverage. And so when we looked at an analysis of paying our nurses premium pay versus us outsourcing with Relay Care, it had a cost savings for us of about $234,000 difference by choosing an outsourced option for these hours. And you can see it picks up from 12:30 a.m. To 7 a.m. and again, all those holidays and weekends. They are the incumbent. We did go out for RFQ on this, and so we definitely had additional vendors come to the table, but they were the incumbent and have done well. And this is a one-year term with four renewal options.
And they're incumbent. They're already providing the service?
Yes, and they're providing the service today.
Okay. Any questions for Joy? Relate Care? If not, we need a motion.
Move approval.
Motion from Reverend Emerson, second from Dr. Casey. Any questions or discussion? All in favor say aye. Aye. All opposed, same sign. That motion carries. That takes us to item L.
All right, so this is consider approval of a purchase agreement between GE Medical Systems for their ultrasound in the district. And this is the work that we do with our biomedical department with Agility. They have run the report that basically says these need to be replaced. They're at end of life. And so this is an agreement to purchase 5 ultrasound machines. Again, this was on our Vizient contract. And so it will help us to continue to provide safe service for our patients.
All righty. Any questions? Need a motion? Motion for Dr. Davis, second. Second from Ralph. Any questions or discussion? All in favor say aye. All opposed, same sign. The motion carries. That takes us to item M.
All right, again, additional 5 other ultrasounds, but this is for you to consider approval of purchase agreement between GE and the district for our echovascular department. So these are very specific to that modality. Again, same thing, working with our team. We have some equipment that's end of life. We're asking for replacement. They are on our Vizient contract.
So regular capital item to be replaced, included in the budget. Any questions for Joy? Not, we need a motion. Motion from DT, second from Dr. Casey. Any questions? If not, all in favor say aye. Aye. All opposed, same sign. That motion carries. Item N, Mr. Showalter, welcome. Thank you, Joy. Good to see you, William.
Good morning, everybody.
Good morning.
I'm bringing forward a request to purchase with General Data Tech, or GDT. They're a value-added reseller of Cisco. The request is for $656,000 worth of Cisco hardware specifically switches through GDT. Last time I was here, I had a request for, and you granted me, thank you very much, a $1.1 million upgrade to the maintenance and service contract. A core component of that contract was locking our services, the cost of the equipment in for a 2-year, and I'm back now to take advantage of that. As part of the network revitalization plan. As a result of this purchase, we can continue with our effort associated with upgrading the switches. Last year, we ended the year at about 55% compliance within an upgraded component. This year, with this purchase, we should end around 70%. Just as a reminder, addressing the refreshes and just ensuring that we're not at end of life. There's a real need to ensure the performance, the reliability, and security. And as a side note, this is in line with HHS's cybersecurity performance goals.
Is this something that we would expect Joint Commission to ask about and look at?
Not Joint Commission. They're not at that point yet.
Okay.
But HHS is preparing.
HHSC will, okay. All righty. Any questions for Mr. Showalter?
Is this new hardware or is it recycled?
No, this is brand new.
And my other question, I noticed this vendor is from Dallas, which is not Tarrant County. Did we have any vendor or bidders from Tarrant County for this?
We have yes, we have looked at other vendors over the course of the history, of Cisco VARs. Yes, sir.
And they're just able to beat us on price?
Yes, sir.
Very good.
All right, any other questions? If not, we need a motion to approve. So moved from DT. Second.
Very much.
Second from Mr. Davis, Dr. Davis. Bill, thank you for being here. We appreciate it.
Thank you.
Any question or discussion? All in favor, say aye. Aye. All opposed, same sign. That motion carries. And Zelia, welcome.
Thank you.
Great job already today, without even having to say anything.
Thank you. It's exciting to see the fruits of everyone's passion and labor.
Great stuff.
Good morning. I'm here today for you to consider approval of an interlocal agreement for funding of specified county programs between Tarrant County and the Tarrant County Hospital District. The total cost is $21,068,000. $68,618 for a one-year term, and this is being absorbed in the approved operational budget. So this provides funding for specified countywide behavioral health services, intellectual disability services, and public health to be provided to Tarrant County residents through MHMR of Tarrant County and the Tarrant County Public Health Department. This does provide a refund to the district of any unexpended or unencumbered funds at the conclusion of the contract, and it aligns with our strategic plan to improve patient outcomes.
So this is the big one, right? Let's discussion on this item at the board level. So what happened from last year, Zelia? How much more are we paying this year?
What we had budgeted for FY24 in the request, there's a delta of $643,019.
Okay, and just to be clear, this was a number that was given to us,
Correct.
not a number that we put any KPIs to or did anything relative to value engineering or any of that. It's a number we were given, right?
Yes, sir. They submitted it after our budget process with what we had already budgeted, so that was the delta.
I will trust that the irony is lost on no one in this room. Any questions for Zelia?
Yeah.
Is that a motion, DT?
Are you talking about me?
So I need a motion.
No, I have some questions.
All right, good. Well, jump in there, believe.
So $21,068,618. I don't think we can probably say that number too many times. As I read this, I was trying to figure out what the structure of this is. Are we paying money to an entity for services that we will then provide?
No, sir. So public health, $1,382,000 of those dollars goes directly to public health for them to provide countywide public health services. And then 7.9 million and some change goes to MHMR for them to provide mental health care in the jail.
And these are services that we also provide.
We do not in the jail.
Well, that we could, maybe is the better way to say it.
We do some of them. MHMR has some special, because of their connections with the state hospitals and HHSC, different mechanisms that they're able to do that we can't do. But, so.
I'm not making the motion, DT.
It's not going to matter, I'll tell you that. This is, tongue in cheek aside, the good folks at MHMR and the work that they all do is fantastic. And this is never, ever from our board to be taken as criticism. It is only the irony that we are given a number. We are asked to put into our budget with zero input on whatsoever, while we work so hard to make sure that we equate KPIs and budget and efficiencies and tax cuts. We do all of that at JPS, but sometimes we just get a number sent to us and said, put that in there for your budget. So it's always, yeah.
Or whether we could do it more efficiently. Yeah. And again, that's no expression on anybody else.
I get it. I get it. We're all on the
we
same.
provide services here, and I think we do it well, and we do it very well, as we saw earlier today.
Yeah. Okay, so any other questions?
Well, we just get a picket sign and go down to county.
We could do that.
Yeah.
We could do that. Then next year, the number just be
We all
bigger.
get removed, but the board.
All right, somebody give me a motion. So give me a motion. All right, Dr. Casey, thank you. A second? Second from Dr. Davis. The two positions have to lead us in this. That is a sad state of affairs. We put the positions in the business.
Puckered up over here.
Exactly. That's
Great.
true.
Great.
Any questions or discussion on the motion? If not, all in favor say aye. Aye. All opposed, same sign. That motion carries. Zelia, thanks always for your good work for bringing us this very popular item.
Yes, it's my favorite since I've been employed here, by the way.
It's always a fan favorite.
Yes. I do appreciate your comment about MHMR because they are a good partner
Yeah.
with JPS.
Yeah, they are. And this is never aimed at those providers at all. It's just the irony of the circumstances that we find ourselves in. Do we have anything for executive session? We do not. We do not have anything for executive session. So, Madam CEO, is there anything else we need to do here today? No. We have an HR committee meeting starting at what time?
12.
So we'll see you guys again in about an hour. We'll stand adjourned. Thank you.